going to be breaking down the key steps for finding the right specialty for you. Find the field that you are passionate about. Hello everyone and welcome back to my YouTube channel. My name is Zara and I'm a registered nurse working in the UK. If it's your first time watching my videos, welcome. On this channel you'll find me making a whole bunch of videos and vlogs related to nursing life, particularly here in the UK. In this video we're going to be exploring choosing your nursing specialty. Some people know exactly what they want to do when they qualify, some have a rough idea, or perhaps you're someone who was like me and really you just don't know what you want to do. So a little bit about me and my nursing background. I've been qualified for nearly 3 years now. My nursing background is a combination of general surgery, intensive care unit, and more recently specialty nursing in acute and chronic pain management. And I kind of built my own system, so to speak, on how I went about finding the specialty that I now work in and that I love. And I'm going to actually be sharing how I went about it with you guys. So this video is going to be like a step-by-step breakdown, and hopefully by the end of this video you will have at least a better idea of what specialty you wish to go into, or better yet, you know exactly what you want to do. So let's get started. I believe the first question you want to ask yourself is, do I see myself working in a hospital setting or in a community setting? So you're not even thinking about the specialty yet, you're just thinking about the setting. This was the first question I had asked myself. I based my decision on the experiences that I had as a student nurse. I worked in a variety of different primary care settings and also a variety of hospital related settings as well. And I just decided what I enjoyed more. Whilst there were some aspects of community nursing that I absolutely enjoyed, I believe like my heart, or where I really wanted my first job post, was in a hospital setting, and that's what I did. So you really just need to ask yourself between the two, and there are great opportunities within both areas. So if you're someone who is leaning towards community, or maybe you're curious about going down that route, then go for it. In fact, there's been a lot of positive encouragements for newly qualified nurses to take up their first job post within a community setting rather than that traditional route of going to work in a hospital first. So just be honest with yourself and decide, ward or community. So let's just say you've decided to go work down the hospital setting route, but you still don't know what specialty you want to go into. There are so many options and it can feel overwhelming. The next question you want to ask yourself is, do I see myself working in a medical setting or a surgical setting? There is this classic nurse saying that you are either a medical nurse or you are a surgical nurse. I definitely agree with this. Med-surgical nursing are polar opposites to each other, yet they have an equal amount of amazing opportunities within their respected fields. Personally, I knew I enjoyed surgical nursing more than I did medical nursing. That's just a personal preference. And again, I used my experiences as a student nurse to make that decision. You can even apply for a surgical or a medical rotation program. I think rotation programs are actually brilliant. If you okay, I want to definitely go down the medical nursing route, but you don't know exactly what type of medical nurse you want to be, a rotation program can at least offer you some options. And then at the end of your rotation program, you can then decide on what exactly you want to do. If you're unable to get onto a rotation program, then another alternative is applying to a general surgical ward or a general medical ward. This is something that I did, and within that I was exposed to a whole variety of different patients that I wouldn't have been exposed to if I worked on perhaps an acute ward. So yes, definitely ask yourself the question, medical nursing or surgical nursing? Okay, so let's talk about specialty nursing. Areas of nursing that require a specific skill set, referring to specialties such as A&E, intensive care unit, scrub nursing. These are areas that typically would involve you having some kind of experience, at least 6 months in a ward or an acute setting before actually applying. There are some exceptions. What you may find is some hospitals might actually take on graduate nurses that have done their final placements within these areas, but typically you would need some experience beforehand. And personally, I do agree with this. As someone who has worked in intensive care unit, I strongly believe that my experience working on a ward definitely helped with my transition, and here are some reasons why. ICU is a unit where the sickest patients in the hospital are. They could be directly transferred from A&E, step down from theatres, they could be deteriorating on an acute ward and being transferred as an emergency to ICU. An ICU nurse with a minimum of at least 6 months of experience in an acute setting, medical or surgical, is brilliant because you have an understanding of where your patient has come from and what has led to them deteriorating. Another key reason is wards are a great place to consolidate all of your skills, such as acute skills, medicines management, and most importantly, time management. On a ward, you are typically looking after 5 to 6, sometimes even 7 patients. In ICU, that's one-to-one care. In A&E, that's quick patient turnover. In scrub nursing, that's also one patient at a time. But really, on the wards is where you're developing these important skills. So when you've grasped those skills and then you want to transition into these areas, then you'll find yourself having a lot smoother transition when you go into these specialty areas where the patient caseloads can be quite different. Of course, if you are set on becoming an A&E nurse, ICU nurse, a scrub nurse, then go for it. You can definitely apply directly to these areas, and it just depends on the individual job requirement. However, if you're someone who perhaps wouldn't mind waiting a bit, or you're unsure and you don't mind kind of pursuing it at some point, then I suggest gaining some ward experience beforehand and then making your decision. So let's talk about our fabulous community nurses. If we go back to our original question of hospital versus community, let's just say you've decided to go pursue the community nursing route. Amazing, because you are going to be exposed to some amazing specialties, and definitely there is one that is right for you. Explore some of these examples. Let's talk about district nurses. District nurses tend to the healthcare needs of people of all ages, often in their homes or GP surgeries. District nurses play a very important role in the continuity of care for patients who are often discharged from hospitals with either long-term conditions or perhaps acutely unwell conditions as well. As nurses, we have to be adaptable, but certainly district nurses do. And that's because you are actually going to different environments. You're going to the patient's home. You're no longer in this controlled hospital environment where there's rules and regulations as such. You are tailoring your care to the patient in their space. District nurses also know how to get their steps in. I had a 6-week district nursing placement. Definitely, I learned so much. Lots of walking, lots of learning as well. And whilst it personally wasn't for me, I have some course mates who went directly into district nursing post-qualifying and they have loved it. Some of them are even junior sisters right now, band 6 positions, and it's just got great career progressions as well. So if that's something that you're interested in, definitely go for it. Another common primary role is general practice nursing. A GP nurse works in a general practice and they form an integral part of the primary care team. They're often made up of doctors, therapists, and even pharmacists. You definitely have the prospect of developing into senior positions, managing your own caseload, and even running your own clinic depending on your level of experience and of course your qualification. There are definitely great specialties within the community setting. You just really got to find the one that speaks to you and to look more into it. If you follow all these steps, find the specialty, and then at the end of it realize, actually, this is not the specialty that I want to work in. I don't want to do this anymore. Nurse Zara, I listened to what you said and I still am not happy. Well, simply put, it is absolutely fine. Please don't start questioning life and going into this weird potato life where, you feel like nursing is just not for you. Sometimes you have to try something also to know that it's not for you, right? I guess that can be put to so many things in life, right? You don't want to live with any sort of ifs or buts or maybes. And also why I am a full supporter of the hashtag YOLO mantra. Yes, I will give myself as an example and share my story with you all. I had the opportunity to work full-time as an intensive care unit nurse post my second redeployment following the second wave here in the UK. I was always curious about ICU nursing, and I knew at some point I wanted to gain some experience there, and maybe even on a bigger scale felt like that was the specialty that I was meant to be in. Whilst I enjoyed my time there, I loved the team, I felt like I had the capabilities of developing into a competent ICU nurse. It was in fact through my time working in ICU that I actually realized it's not the specialty for me, and that's okay. You learn, you move on, and fortunately with nursing and picking your specialty, it is quite easy to move across different specialties. I know ward nurses who have made the move to community nursing. I know community nurses who have moved to the ward setting. There are nurses who have pursued a career down scrub nursing and then later transitioned to ICU nursing. There are ICU nurses who want to go into A&E nursing. There really is so much possibilities, but don't ever feel like once you've made a decision on a specialty, you have to stick at it, because that couldn't be more false. So ultimately, you have the choice. If you enjoyed this video, then do click that like button and leave some comments down below. I am intrigued. Let me know what specialty of nursing you're interested in going into. If you are interested in developing more within your nursing career, then do check out my How to Choose Your Nursing Career Pathway video, where I dive deeper into the amazing possibilities where you can take your nursing career. I will see you guys in my next video. Take care and stay safe.